Stitching it together, exploring 5 common surgical sutures. Surgery involves intricate procedures where tissues are manipulated, repaired, or removed to treat various medical conditions. Surgeons employ different types of stitches, sutures, based on factors like tissue type, surgical site, and healing requirements. Here are 5 common stitches used in surgery. 1. Interrupted suture. Interrupted sutures are widely used for wound closure. They involve individual stitches placed at intervals along the incision or wound edges. This technique provides precise alignment of tissues, reduces tension, and allows for better wound healing. Interrupted sutures are versatile and suitable for various tissue types, making them a preferred choice in many surgical procedures. 2. Continuous suture. Continuous sutures involve a single, continuous strand of suture material used to close the wound in a running fashion. This technique provides rapid closure and is efficient for long incisions or areas with minimal tension. Continuous sutures distribute tension evenly along the wound, promoting better cosmetic outcomes and reducing the risk of tissue ischemia. Surgeons often use continuous sutures for closing abdominal incisions, skin lacerations, and other surgical wounds. 3. Running subcuticular suture. A running subcuticular suture is a variation of the continuous suture technique used primarily for closing skin layers. Unlike traditional continuous sutures, the subcuticular suture is placed beneath the skin surface, resulting in a cosmetically appealing wound closure. This technique minimizes suture track marks on the skin, reduces the risk of infection, and enhances patient comfort during healing. Running subcuticular sutures are commonly used in plastic surgery, dermatologic procedures, and cesarean sections. 4. Mattress suture. Mattress sutures are designed to avert wound edges, providing better approximation and tension distribution. They consist of 2 parallel lines of suture material with intermittent loops passing through the deeper tissue layers. Mattress sutures are effective in closing deep wounds, securing flaps, and reinforcing weak tissues. Surgeons often use mattress sutures in orthopedic surgeries, plastic reconstructions, and closure of complex wounds. 5. Horizontal mattress suture. The horizontal mattress suture is a variation of the traditional mattress suture, characterized by its horizontal orientation. This technique involves placing the suture parallel to the wound edges, creating a stronger and more stable closure. Horizontal mattress sutures are beneficial for wounds under significant tension, such as scalp lacerations, where they prevent wound edge inversion and promote optimal healing. They are also used in tendon repairs and deep tissue closures. Common stitches. Surgeons may utilize specialized sutures such as absorbable or non-absorbable materials, barbed sutures for tissue approximation without knots, and pledgeted sutures for reinforcing fragile tissues. The choice of suture technique and material depends on the specific surgical procedure, patient factors, and desired outcomes. Surgeons undergo extensive training to master various suturing techniques and ensure optimal wound healing and patient recovery.